Hello, my name is Catherine Evans. I am a graduate student at the University of Tennessee Health Science Center in Memphis, Tennessee. I currently hold a Bachelor of Science degree in dental hygiene, and I am also currently a registered dental hygienist in Tennessee. Today we're going to be covering a clinical skill, the use of a universal curet, specifically the Colombian 1314. We are going to be using assessment strokes and activation strokes in order to learn how to angulate the instrument to the tooth.
All necessary materials. Position yourself and patient for working in quad 4 buccal surfaces. Determine the correct working end for quad 4 buccal surfaces. Properly grasp the universal curet. Establish a stable fulcrum for instrumenting tooth number 32 buccal surface. Identify the distal line angle of tooth number 32. Open the blade to tooth angulation to 70 degrees and use an assessment stroke. Continue this stroke distal until you reach the interproximal. Be sure to go slightly lingual to the direct distal to ensure that you cover the entire circumference of the tooth. Still using an assessment stroke, move your instrument back to the distal line angle and roll the toe inward towards the tooth until the instrument toe is pointed mesially. Continue the assessment stroke along the buccal surface of the tooth and into the mesially interproximal area, going slightly lingual to the direct mesial. If you do locate any calculus, move the instrument under the deposit and apply pressure to your fulcrum. Finger while placing lateral pressure to the surface of the tooth. Begin instrumenting. Move the instrument firmly, making the necessary strokes to remove the deposit. Wipe the instrument with gauze and continue to the next tooth. If you do not locate any calculus, continue using the same technique in sequence and move to the next tooth. When you have reached tooth number 27, you will insert the instrument slightly distal to the midline and use the assessment stroke mesially along the facial surface until you reach the mesially proximal surface. Again, be sure to extend your stroke slightly lingual to the direct mesially surface. Continue this pattern, instrumenting the away surfaces through tooth number 22. Flip your instrument to the other working end and move to tooth number 17 buccal surface. Locate the distal line angle and insert the instrument toe under the gingival margin using the same sequence of the steps we used for tooth number 32. Move anteriorly to tooth number 18 and continue. When you reach tooth number 22, you will insert the toe of the instrument under the gingival margin, slightly distant to the midline of the tooth and instrument mesially unto the proximal surface of the tooth. You will again instrument slightly lingual to the direct mesial of the tooth surface. Continue this technique across the lower facial anterior tooth through tooth number 27. Now you are ready to move to the lingual surfaces of quadrant 4 using the same techniques and sequence you use for the buccal facial surfaces of all lower teeth. Continue practicing this skill until you feel confident or until the end of lab, whichever comes first. Put away all materials used.
I hope everyone has enjoyed this presentation I put together. The lesson plan material information was provided by another Master of Dental Hygiene student, Diana Myers. If anyone would like any more information regarding the use of instruments or dental hygiene, please go to the University of Tennessee Health Science Center website. Thank you.